This is my presentation on Marfan syndrome. In this presentation, I will be discussing Marfan syndrome by breaking it down into six main parts. These are etiology, which is the cause of the disease, demographics, which explains who is affected, anatomy, which covers the organs and tissues involved, physiology and symptoms, which tells us how the body is affected and what signs to look for, diagnosis and treatment options, and finally, how artificial intelligence is being used in medicine to support patients with Marfan syndrome. Marfan syndrome is caused by a mutation in a gene called FBN1. This gene is located in chromosome 15. The FBN1 gene is responsible for making a protein called fibrillin-1, which plays a major role in building and maintaining connective tissue. When this gene is mutated, the connective tissue becomes weak and stretchy, which leads to many of the problems seen in Marfan syndrome. This syndrome is inherited in an autosomal dominant pattern. This means that only one copy of a mutated gene from one parent is enough to cause the condition. However, about 25% of the cases happen due to new mutations with no family history. Artificial intelligence tools like deep variant and polyphen2 are used to identify these genetic changes. These tools help doctors understand how severe the mutation might be and predict the risk of the disease early and more accurately. Marfan syndrome affects about 1 in every 5,000 to 10,000 people in the United States. It can affect people of all races and ethnic backgrounds equally. It does not favor one gender over another, so both males and females are equal risk. This makes it a condition that healthcare providers should always be aware of, no matter the background of the patient. In the countries with fewer healthcare resources or limited access to genetic testing, Marfan syndrome is often underdiagnosed. That means many people might have the condition but don't know it because they haven't been tested. A study by Boys and colleagues in 2010 discussed how important it is to use accurate diagnostic tools and international guidelines to ensure early detection. Marfan syndrome mostly affects the body's connective tissue, which supports many organs and systems. Some of the main areas affected include the skeleton, where people often have unusually long arms, legs, and fingers, as well as the heart and blood vessels, especially the aorta. The eyes also can be affected, often leading to lens discoloration. In some cases, even the lungs and skin may be involved. These diagrams show the major systems affected by Marfan syndrome. You can see the skeletal features like long limbs and scoliosis, and the cardiovascular system, particularly the aorta. Fibrillin-1 is normally responsible for giving strength and flexibility to connective tissue. When this protein doesn't function properly due to the FBN1 mutation, tissues like the walls of the blood vessels become weak. This makes organs such as the heart and blood vessels vulnerable to damage over time. For example, the aorta may stretch too much and eventually tear, which is life-threatening. People with the Marfan syndrome usually have a tall and slender body shape, very flexible joints, and flat feet. Eye problems like discolored lens are also common. One of the most serious issues, again, is the enlarged and weakened aorta. If left untreated, the aorta can rupture, and that's life-threatening. But according to Dietz and colleagues in 2005, if Marfan syndrome is treated early and managed carefully, life expectancy can reach up to 7 years or more. To diagnose Marfan syndrome, doctors usually perform a full physical examination, an eye examination, and take images of the heart using echocardiogram or MRI. Genetic testing for mutations in the FBN1 gene can confirm the diagnosis. Treatment focuses on preventing complications. Beta blockers and ARBs are medications used to reduce stress on the aorta. In some cases, surgery is needed to repair an aortic aneurysm. Marfan syndrome is a chronic condition, which means there is no cure. However, people can live long, healthy lives if they follow a treatment. AI models like CardioNet are being used to help monitor the heart and blood vessels in real time. AI helps doctors catch problems early and create personalized treatment plans based on the patient's risk. Here's my reference page used throughout this presentation. They include research articles, government health resources, and scientific books that support the information provided.